In tonight's Health Edge, we're talking about the stimulant Adderall, which is prescribed for ADHD. It seems more and more students and young adults are misusing this drug.
This is resulting in a rise in emergency room visits. Dr. Nandi is here with what we need to know about the drug and what else we can do to stay focused.
It's an important problem. You know, Adderall is being misused by students and young professionals who believe they needed to focus while studying for an all-night exam or to help them learn faster. So my prescriptions for staying focused, first of all, get organized. Important. Keep an organized space and remove anything that can distract you from that task, right? Number two, manage your time. Make a to-do list and stick to it. Prioritize your tasks, write how long it'll take you to accomplish them, be realistic, and then make each task count. Complete the task within the confines of each time limit. Also, make time for breaks. Don't sit at your desk all day or move around, and you should take about 5 to 10 minute breaks for every hour of work you do to keep yourself motivated. Also, talk to your doctor. If you think you may have ADHD, talk with the doctor and make sure that you can do something about it.
So what should we look out for? What are the symptoms of ADHD?
There's two types, right? There's one that's hyperactive and the other one's inattentive. The symptoms include inability to notice small details, being easily distracted from the task at hand by unrelated stimuli like noises, smells, people, inability to focus on tasks long enough to complete them, and frequently moving from one incomplete task to the next, chronically procrastinating. You can be disorganized and forgetful, difficulty in social situations specifically, and inability to stay on one topic at a time or stay focused while others are speaking. Also, you'll see people fidgeting, especially when seated, impatiently and constantly interrupting others. And you can see this in your kids. We do, we say highs and lows at our dinner time for all the kids, and you can see at that time which kids are a little bit more prone to that.
So, Doc, if your child does not have ADHD and they are taking Adderall to further their studies or whatever they choose to use it for, what will we see in them? So
the drug is a central nervous system stimulant, and it's believed to improve attentiveness, organization, and performance in people who have trouble staying focused, but not people who are just not sleeping and not taking the appropriate tests.
Can exercise help at all?
Absolutely. We know that when you exercise, it reduces stress and boosts energy. There's a chemical called serotonin in your brain that's increased when you exercise, and we know, if you get up and going, it helps everything.
All right, Doc. Well, athletes threatening to pull out of the Olympics in Brazil. We're talking about the Zika. This is really turning into a worldwide fear.
It is, and I think that I understand if you're an athlete, you don't want to get infected, but I'll tell you, people are watching, unless you're a pregnant woman or somebody who's thinking about being pregnant, I don't think you need to bail out of the Olympics. Again, if you go to an area with Zika and you have the symptoms, which could be red, itchy eyes, joint pains, fatigue, then definitely when you come back home, listen, your partner and you need to have either abstinence or safe sex. If you don't have any symptoms but you're still there, you still should have safe sex for about 28 days after. But you can still go there, and if you're an athlete, I would encourage them to perform there.
All right, Dr. Nandi, out of time. We appreciate you.
All right.
Yeah, thanks so much, Doc. And if you have a question or health concern for the good doctor, you can email him at drnandi@WXYZ.com or send it to us, Facebook, Twitter, email, a phone call. We'll get it to him.